Her Majesty's Government. Health is everyone's business. Government responds to the consultation on proposals to reduce ill health-related job loss. Executive Summary. In November 2017, we published Improving Lives, the Future of Work, Health and Disability, which set out our plans to transform the employment prospects for disabled people and those with long-term health conditions over the next 10 years. In it, government set a goal to see 1 million more disabled people in work by 2027, and to realise an ambitious vision for society where people understand and act positively upon the important relationships between health, work and disability. Government continues to focus efforts across 3 key settings in order to achieve this: the welfare system, the workplace and the healthcare system. Health is Everyone's Business put forward a number of proposals to minimise the risk of ill health-related job loss through better workplace support for disabled people and those with long-term health conditions. It explored changes to statutory sick pay, occupational health, information and advice, and employer guidance. The Health and Disability Support Green Paper explores how to improve support for disabled people through the welfare system. Together with the forthcoming National Disability Strategy, they are part of this government's holistic approach to support disabled people and those with long-term health conditions to live full and independent lives. Whilst this response focuses on the measures outlined in Health is Everyone's Business, work beyond the scope of this response has continued at pace. For example, we have taken steps along with local partners to advance the work and health agenda, in particular in the area of prevention. We also want to ensure there is better integration between health and employment support services, which will help people with long-term health conditions to enter and stay in work. The majority of employers agree that there is a link between work and the health of their employees. Employers who invest in the health and well-being of their workforce benefit from reduced sickness absence, increased productivity, and improved workplace retention. Employees benefit from a supportive environment in which they can thrive and perform at their best. Being in work can help someone to be independent in the wider sense by having purpose and self-esteem, by building relationships, and by being financially independent. As Improving Lives set out, we want to see individuals, where appropriate, benefit from a preventative approach to ill health and an environment which supports health promotion. We want to see employers creating healthier workplaces and offering the right support to their staff. We also want both employers and their staff to be supported by a health system which promotes good health and helps them to better manage their conditions. Much of the focus of this document is on the role employers themselves play, but we also recognise that when individual employees are struggling with health issues and engaging with the health system, there are opportunities to provide them with advice to help them manage the employment impact of their condition. To that end, we have integrated employment advice provision in the NHS's Improving Access to Psychological Therapy (IAPT) services in England, invested in individual placement and support (IPS) with local partners to test new ways of supporting people to enter, re-enter and stay in work. We have also worked with NHS England Improvement and Public Health England to explore barriers and enablers to partnership working on work and health in local systems. We're currently undertaking further exploratory work on the development of partnerships, strategies and greater integration of services at a local level. Impact of COVID-19. The consultation was published at a time when employment was at a near historic high, and disabled people's employment had also improved significantly. Between October to December 2013 and October to December 2019, the number of working-age disabled people in employment increased by 1.4 million, from 3 million to 4.4 million. It set out to build on that progress by introducing a comprehensive and balanced package of measures to support more disabled people and people with long-term health conditions to remain in work. Since then, the impact of the COVID-19 pandemic has been widely felt across the economy and society. In response to the pandemic, government acted swiftly to protect the incomes of millions of people, including through the Coronavirus Job Retention Scheme, CJRS, and Self-Employed Income Support Scheme, SEISS. This was followed by the Chancellor's Plan for Jobs, which set out to protect, support and create jobs. At Budget 2021, government announced the extension of the CJRS and SEISS alongside an additional £5 billion for new restart grants and a new UK-wide recovery loan scheme, which will make available loans to help businesses of all sizes through the next stage of recovery. This combined economic response is one of the most comprehensive and generous in the world. The pandemic also highlighted the important role that health professionals play in the work and health agenda. OH professionals, who provide expert advice and support on work and health issues, have played a critical role in supporting the response to COVID-19. For example, they have supported employers to provide advice on workplace adjustments and supported individuals recovering from COVID-19 to return to work. Finally, we have taken a cross-government approach to considering and responding to the challenges to mental health and well-being presented by the pandemic, contributing to the COVID-19 Mental Health and Wellbeing Recovery Action Plan, which was published 27th of March 2021. This is the government's plan to prevent, mitigate and respond to the mental health impacts of the pandemic during 2021 and 22. The impact of the pandemic, including on the labour market and health of the nation, increases the need to progress the important shared agenda of work and health. The package of measures announced here reflects feedback from the consultation while acknowledging the impact of COVID-19. This balanced package of measures will enable and encourage employers to take greater responsibility for the health and well-being of their employees by offering increased government support, including through improved information and advice and access to OH provision. Chapter 1 sets out how government will provide employers with access to good quality information and advice. Employers, and small and medium-sized enterprises, SMEs in particular, may lack the time, capacity or expertise to manage health events in the workplace or to search for the most relevant guidance. Employers have told us that while they trust government advice in this area, the current information on offer is fragmented and not always easy to apply to real-world problems. Respondents ask for better integrated advice and information that is easier to find and act upon. Government has improved guidance for employers and employees in response to the pandemic, including on returning to workplaces safely. Government now intends to build on this by refining the information and advice given to employers on health, work and disability. This will be easy to navigate and readily usable, especially for SMEs. Chapter 2 outlines government plans to support employers and employees during sickness absence. The majority of respondents agreed that statutory guidance should be strengthened, stating that clear guidelines would give employers more confidence to act and provide consistency in their approach. Government has therefore asked the Health and Safety Executive, HSE, to work with other arm's-length bodies, ALBs, to develop non-statutory guidance to support disabled people and people with long-term health conditions to remain in work, and on managing any related sickness absence. HSE will also explore introducing statutory guidance in this area. Although respondents supported the intent of the proposal, there was concern that introducing a new right would risk undermining existing workplace protections, most notably the duty to make reasonable adjustments. In particular, in light of feedback, government has decided not to proceed with the consultation proposal to introduce a new right to request workplace modifications on health grounds, but will instead take steps to increase awareness and understanding of existing workplace rights and responsibilities. In particular, the duty to make reasonable adjustments under the Equality Act 2010. We heard concerns that a right to request workplace modifications may legitimise refusing requests for adjustments and detract from the positive duty on employers to make reasonable adjustments. Chapter 3 covers statutory sick pay, SSP. The consultation sought views on a range of measures related to statutory sick pay. These measures sought to make the system more flexible, simple and responsive. The pandemic has shone a light on the importance of SSP, and over the last year, government has made several changes to the system to support those who were self-isolating and unable to work as a result of COVID-19. Government maintains that the pandemic was not the right time to introduce changes to the rate of SSP or its eligibility criteria. This would have placed an immediate and direct cost on employers at a time where most were struggling and could have put more jobs at risk. Government instead prioritised changes which could provide immediate financial support to individuals, including changes to the wider welfare system, the introduction of the test and trace support payment, and wider economic support such as the Coronavirus Jobs Retention Scheme. As we emerge from the pandemic, there is space to take a broader look at the role of SSP. Chapter 3 covers the feedback from respondents to the proposals in the consultation that covered SSP. Chapter 4 outlines the steps that government is taking to enable SMEs and self-employed people to reap the benefits of expert health and work support, including OH. This will be informed by learning from the innovations that have underpinned the health system's response to the pandemic, with some evidence of increased demand for OH as more individuals adapt to new working environments and require support to return to work. The uptake of other measures outlined in this package is also likely to increase demand for OH. Small employers are 5 times less likely to invest in OH services than large employers. Government will seek to address this by testing and evaluating the impact of a subsidy for SMEs and the self-employed, designed to reduce the cost of accessing suitable OH. The evidence and affordability of a subsidy, alongside developments in OH reform policies, will inform the case for a potential fixed-term rollout in the future. More accessible OH services may lead to a rise in demand, and potential new customers of OH will require support to ensure they're not purchasing inappropriate or low-value services. Government will take action to improve information and guidance on purchasing OH and explore the potential of outcome-linked measures to support providers to improve and innovate, helping employers to choose the most appropriate services for their needs. This includes piloting outcome-linked metrics with OH providers and employers, which could be used to support continual provider improvement and improve employer choice. Government will work with the market to explore how it can support faster innovation in OH, particularly in relation to innovative ideas that prioritise new OH service models and make greater use of technology, with the aim of increasing SME self-employed purchasing of OH. Government is also committed to working with key delivery partners to explore the potential merits of a new Centre for Work and Health Research that could strengthen the research infrastructure that supports long-term innovation in OH. The chapter concludes by addressing concerns over shortages in the OH workforce and details government plans to respond by considering methods to promote the expansion of clinical roles, improving OH multidisciplinary workforce models which capture both clinical and non-clinical roles, developing new training approaches, and establishing an OH leadership function to help drive the OH workforce strategy. Chapter 5 sets out other issues raised during the consultation, which include insurance, tax, access to work, and proposals to enable better use of the FitNote, a key tool which can be used to support workplace conversations and returns to work. Although not in the consultation, many respondents took the opportunity to share views about how the FitNote process could be improved. There was a general consensus that the FitNote remains an important tool, but should be reformed so that it better supports people to stay in and return to work. The launch of the isolation note in response to COVID-19 has demonstrated the flexibility and responsiveness of employers and the healthcare system through their acceptance and use of an alternative form of evidence. Government intends to build on this learning and continue to explore opportunities for digital transformation of medical evidence provision. Government is also exploring extending FitNote certification to a wider group of healthcare professionals and introducing digital certifying of FitNotes, as well as looking towards further opportunities to make the FitNote interactive. These changes will make the FitNote a more effective tool in supporting healthcare professionals to deliver holistic health and work conversations that the government believes are essential in supporting their patients to remain in or return to work. Some respondents highlighted the importance of insurance products as another way of supporting workers' health and well-being. Government welcomes recent proposals from the industry body Group Risk Development, GRID, to develop a consensus statement which aims to enhance employer guidance, improve employers' awareness of the link between good work and good health, and promote the use of expert-led support services. Government will continue to work with the industry to improve awareness among employers and self-employed people of the benefits that protection policies can provide. Several larger organisations called for tax incentives in response to early consultation feedback and to recognise the variable availability of welfare counselling. Changes were made in the March 2020 budget to enable employers to provide non-taxable counselling services. This includes related medical treatment such as cognitive behavioural therapy. The changes took effect from April 2020. A number of respondents commented on the valuable contribution Access to Work makes in supporting disabled people and those with long-term health conditions to receive adjustments to enter into and remain in employment, and told us they thought more could be done to promote the service among employers and individuals. Government continues to promote Access to Work as part of Disability Confident and is undertaking further marketing and promotion of the Access to Work programme. An overview of the potential costs and benefits of the full policy package set out in this response is given in the annex, along with a methodology of measuring these impacts. It supports a balanced package of measures in which both government and employers go further to support health and well-being at and through work. It describes the costs and benefits to business and the wider societal benefits the measures will bring.